Hi, my name is Ed Coates and I'm a fertility consultant in Oxford and in London. I am also the co-founder of Total Fertility. We set up Total Fertility in 2017 with the prime aim of trying to create a really rich resource for patients online. It's a digital platform that was created to be patient-facing at no charge to the patient, with the sole aim of trying to put all of the information that you're looking for into one place. Patients, unfortunately, are looking all the time for their options with fertility, and they're having to do this digitally for a number of reasons. The information now is all online and it's quite a confusing area. So we hopefully have created a hub where you can find a lot of information out very quickly to try and guide you through your fertility issues. But the whole focus of today is fertility inequality, and it's Fertility Awareness Week. And so we wanted to create this short webinar just to hopefully help explain some of the differences that currently exist around the UK with regards to fertility treatments, but also then guide you through how perhaps we can help with you looking through to trying to find clinics in your area, trying to find answers to your fertility questions, and also to try and understand a little bit more about how fertility treatments work. So around about 3 or 4 years ago, the NICE guidance were updated. NICE is the National Institute of Clinical Excellence, and they create guidance for clinicians and professionals around all different aspects of medicine. But with regards to fertility, NICE very specifically recommended that people that are subfertile and who are eligible and within a certain age group should be entitled to 3 full cycles of IVF. What they actually said is that if you're a woman under the age of 40 and you've been trying to conceive for 2 years with regular menstrual cycles and regular unprotected sexual intercourse but haven't done so, then you should be offered 3 full cycles of IVF. This is the recommendation, but unfortunately the reality is not the case. The way funding works in the NHS is that there's only a limited pot of money, and there's no time better than the current climate with coronavirus to understand that more than ever. We have a limited pot of money and it has to be shared around all different areas of medicine. That money from the Department of Health comes through and right down to the grassroots, and to the area where we have the money then spent is done through what's called clinical commissioning groups. The clinical commissioners have a difficult decision as to where to spend the money, and the money has to be shared out equitably between different areas of healthcare, and that's rightly done regionally because different demographics and different areas of social wealth and health will depend on how people cope, and requirements for all this differ from different parts of the UK. And so therefore it is right that it's done that way, but what this has led to with fertility treatment, sadly, is quite a difference across the country with regards to the fertility treatments that people are eligible to, but also what they can access locally. So whilst we have national recommendations, we don't yet have a national policy that applies across the country. So you can live in one area and be entitled to very much more than somebody who lives in a completely different area, but also the reverse of that. You could live in an area and be entitled to no fertility treatment, but if you live 15 miles away, you may be entitled to an IVF cycle. So there are 135 clinical commissioning groups in the UK, in England, and these clinical commissioning groups have to create a policy around eligibility for funding, and they have to do that and create some quite strict criteria which the doctors will then follow when they end up seeing fertility patients in their NHS clinics. And I've spent many years having to chat to patients about this, and the inequity of it does seem quite unfair when you look at how this differs across the UK. There are less than 10% of these CCGs now which are offering the NICE guidance recommended 3 full IVF cycles for under 40s. Between 40 to 42, you should be offered 1 IVF cycle, and in some areas there is no offering of fertility treatment at all. So the clinical commissioners do have a very difficult job because the pot of money is limited, but they're also having to battle with the requirements of patients as well. And unfortunately, fertility is such an emotional area for everyone involved, whether you're a clinician or a patient. It can be very difficult for patients. Unfortunately, fertility also becomes very expensive if you have to self-fund it. So in 2017, we created Total Fertility, and there's a lovely area on the website where you can look at different CCGs and look at what your access enables you to get in your area based on where your GP is based. And this information can be found quite easily through our pages. There's another fantastic website called Fertility Fairness, which will help you find what you're entitled to according to your clinical commissioning group area. This updated information does change, and patients often find that the goalposts have changed. So it's really important to keep a really close eye on this if you're somebody that is struggling to conceive and possibly looking towards embarking on fertility treatment in the near future. I would certainly advise that you keep a really close eye on things in your clinical commissioning group and watching to see whether the policy's changed, but also to try and understand what your entitlement is, that if you don't conceive, you'll be able to access NHS funded treatment, and to be able to know when to do that, when to get investigated is really important. So if you aren't eligible for NHS funded treatment, let's say you have already been through fertility investigations, diagnosed and need treatment but aren't able to be diagnosed, then you are unfortunately left to self-fund treatment. And this is the case for many people. And the policy, because it is so different across the country, and some people, and the vast majority of people are only entitled to one cycle of IVF, a number of people are having to self-fund treatment, and treatment is expensive. And that was another reason and another concept behind why we created the website, to try and help people understand what the costs of IVF treatment are, how it's broken down, and also what clinics are available. I work in a fantastic clinic, and there are some fantastic clinics across the country. We are attempting to try and list all of the clinics in the UK so that you can very quickly find them, find the cost of treatment in your clinics, in those clinics, and look at all of your options very quickly and get that information without having to trawl through hundreds of different websites. The HFEA is a fantastic organisation that regulates all licensed clinics through the UK, and so we try to bring that data to you in an easy way to digest, so that you can very quickly as well look at reliable, transparent data. The HFEA obviously regulates all the clinics, and they also therefore will regulate the data that comes from the clinics. So you can look at success rates, you can look at the reviews that are given to clinics, particularly as well. You can also download on the HFEA website what's called the Care Quality Commission reports of how well performing clinics are, and those are easy to attain. So the data that you can find on lots of different pages, as well as different clinic pages, is usually all in one place in Total Fertility, which is the whole purpose of the site. And so we hope you find the pages useful, and hopefully will help you guide you through some of the more difficult and challenging times when you find that actually your access to treatment is either non-existent or perhaps not what you expected it to be, or the level which you wanted it to be. So it's an incredibly important subject. The subject of fertility inequality, unfortunately, is still rolling on. I think facing the challenges that we have currently in health service, I don't think this is going to get any better faster, as there are a number of other priorities for health and clinical commissioning decision makers. But we have to accept that there is still currently huge inequality across the UK in terms of what patients can access in terms of fertility treatments. And so if you do find this a frustration for yourself, the options are to obviously write to your local MP to put pressure back on the government to try and help with the changes that need to happen with regards to fertility treatments, because ultimately we're crying out for a national policy. And once we have this, it will be equitable for all. So if you are finding that yourselves in that difficult position, please have a look at our pages and try and find out whether you can access the information quickly, and also look at all of your options. I hope you found this useful as a quick guide of the NHS fertility entitlements, and also the other options for you when you're looking to self-fund treatment. Unfortunately, the inequality continues, but you're not alone, and we're here to help you and support you. Please like this video and share it with people if you find it useful, and we look forward to seeing you on the website soon.